City officials on Monday provided an update on the coronavirus. Now, there aren't any cases locally, but they are making sure that there are proper precautions being taken in the public and at local health institutions. The medical officer of health, Dr. Vera Etches, provided an update at the mayor's office after speaking with the mayor on Monday.
We're working together very closely, Ottawa Public Health and other city departments, to anticipate and be prepared for the situation in case there is transmission of the virus here in Ottawa. We don't see that. We know that there are more and more countries affected, and the number of people returning from those affected countries is a greater number of people, so we're continuing to test for the virus when people come back from travels and they have respiratory illness. So far, none of those tests have come back positive, but we could anticipate a day, and we want to make sure that we're prepared to limit the transmission of the infection if it is here. Yes, there's a difference between travel imported cases and local transmission in the community. I would say it certainly is probably just a matter of time until we get a case in Ottawa related to travel. What we're hoping all the measures around the world are doing is limiting transmission once it gets into a country. So you see that even in other countries where they have widespread transmission, there's still an effort to contain it. So we know, though, it's challenging. This is a virus that can be transmitted when people have very mild symptoms. People may not know to present, and so it is quite possible that those containment measures will not work in the long run. That's what we're making sure we're prepared to handle. It's business as usual right now. Nothing's changing. But what are we looking at? We're looking at, in the future, what are the essential services we must keep going? I'm in public health, so I think about water treatment. Let's make sure our water treatment plants continue operating, and every service is doing that. Everyone's thinking about what are the key things to keep going if you have more employees that are sick. So like other employers, this is advice that's useful for other employers. Think about those critical functions. Think about what's possible to do remotely. Do you have workers who could work from home to be able to spread out the distance between people and the likelihood of transmission? We're not at that point right now, but we'll certainly advise the public if it changes.